Assalamu alaikum, dear community members. My name is Dr. Omaran Abdeen. I'm a physician practicing in Santa Clarita, and I wanted to deliver to our beloved community a message about COVID-19. As many of you know, COVID-19 has been rampant in Southern California, and the hospitals in our community are full. The intensive care units are full. There are many, many patients who are sick. And I'm urging all of you to take this matter very, very seriously. Many people tend to think that COVID-19 is a virus that infects someone else and that somehow it won't affect them. The truth of the matter is anybody can become infected with COVID-19, and the symptoms vary. Some people don't have any symptoms. Some have mild symptoms, such as a cough, maybe a low-grade fever, and others have very severe symptoms with shortness of breath and overall organ failure requiring the intensive care unit, oxygen, and even a ventilator, and extensive medical support. Because of this, it's important that we all take this matter very seriously and that we take precautions. The first precaution that is extremely important for us to take is to wear a mask. Now, one of the problems that I see frequently is that people do not wear the mask properly. It's important that the mask cover the nose, the mouth, and the chin. I'm going to put one on so you can see what I mean exactly. So you can see it's covering my nose, my mouth, and my chin. And most masks have a nasal bridge fixator that you can push on to mold the top of the mask to the nasal bridge. And that helps prevent droplets from coming into the mask or your own droplets from going out of the mask and infecting other people. So wearing a mask in public, basically outside of your home, is important. When you're by yourself in your car, you don't have to wear the mask. Of course, in your home, you also don't have to wear the mask unless you have somebody at home who has COVID-19, then you should wear a mask when in contact with that person, and it's always preferable to keep 6 feet distance away from the person. The second most important thing that you can do to prevent COVID-19 is to wash your hands. Now, the best hand washing is with soap and water. It's important to use clean water, and any soap. It does not have to be antibacterial soap. Pretty much any soap will suffice. Make sure you put enough soap on your hands to lather both sides of the hand. So you want to lather the palms and the back of the hand as well. You also want to lather in between your fingers. And you also need to wash underneath your nails. And you may say, well, that's very difficult. But one way you can accomplish that is by rubbing your nails against your palm, as I'm doing right now, as you can see, and that helps clean underneath the nails. And don't forget, of course, the thumb as well, and do that for both sides. You should lather your hands with soap for at least 20 seconds. That's the minimum amount necessary to really kill the virus. After you've lathered your hands, then you need to rinse them under clean water, running water, and then dry them, either air dry or use a clean towel or paper towel. If you don't have access to soap and water, immediately you can use a hand sanitizer. Hand sanitizers have to have at least 60% alcohol content to be able to kill the virus. And it's important that you use the hand sanitizer correctly. I often see people using it rather incorrectly. I have a bottle of hand sanitizer here with me. I hope you can see it. And basically, I'm going to put a little bit of hand sanitizer on my palm of my hand. I put it right there and lather both sides, both palms, and then the back of both hands and in between the fingers. So you lather your entire hand, including in between the fingers, and you want to do that for at least 20 seconds as well, and let it air dry. So really, the important thing is to let it dry. I see a lot of people use the hand sanitizer, and then they kind of wipe it off to dry their hand. No, let it air dry, and that will afford it time to kill the virus. Some other measures that I urge you to take is avoid crowded spaces, particularly indoor spaces. I also strongly urge you to maintain a 6 feet distance at a minimum between you and anyone who's not a member of your household. So if you go to the supermarket, if you go try to maintain that distance between yourself and other people as much as possible. Now, if you do become sick with COVID, if you think you might have COVID, some of the symptoms you would experience include fever, although not everyone has a fever. You may have a cough. You may experience a loss of the sense of smell and taste. You may also develop shortness of breath. And that is the most severe symptom of COVID. If you do develop shortness of breath, you should go to a hospital and seek care immediately because you may require oxygen and more aggressive care of your illness. If your illness is mild and you're not short of breath, you can stay at home. Make sure you're well hydrated and rested, and isolate yourself from other members of your family. Use a bathroom separate from that of other family members if possible. If not, then the bathroom should be sanitized after you use it each time. Now, I want to say one word about the vaccine. The vaccine is available. It's available right now to healthcare workers. I myself was vaccinated 2 days ago on Friday. I had absolutely no side effects. I received the shot in my left arm without incident. The vaccine will be rolled out in phases. The next phase will be nursing home residents. And then after that, it will go to people above the age of 65. And then subsequent to that, to the general public, which we anticipate will be in March of 2021. I do urge everyone to take the vaccine, even those who were infected with COVID should still take the vaccine to afford them better protection. The vaccine is highly effective. It is very safe. It is not a live virus vaccine, which makes it extremely safe. You might experience some mild side effects from the vaccine, which are common to all vaccines, such as pain and discomfort in the arm. You may develop a low-grade fever. You may develop fatigue, although these symptoms are fairly rare. There are 2 vaccines that will be available. One is the Pfizer vaccine, which is already on the market. That's the one that I took 2 days ago. You take the first shot, and then 21 days later, you will take the second shot. You have to take both shots to get the effectiveness of that vaccine. The other vaccine, the Moderna vaccine, was approved by the FDA yesterday. It is not yet out on the market, but it probably will be this week. And that vaccine is very similar to the Pfizer vaccine. The difference is you take one shot now, and then you take another shot in 28 days, so 4 weeks later. I do know that there are a lot of rumors surrounding COVID-19 and a lot of rumors surrounding the vaccine and a lot of rumors surrounding mask wearing and crowding and avoiding others and social distancing. And the truth of the matter is these are just rumors. The truth is this is a serious disease. It is killing many, many people, including some members of our community. If you don't really feel this is a serious matter, I urge you someday to maybe come to the hospital. They're not allowing visitors now, but they will soon. And just see how rampant this is and how sick people are. Talk to healthcare professionals who are taking care of patients with COVID-19, and they can relate to you the reality of how serious this illness is. And even talk to patients who've recovered from COVID-19. They will be able to tell you exactly how severe their illness was and what they felt. I urge you to talk to your physician or other healthcare professional about COVID-19 and about any concerns that you may have. I also urge you to go to the Centers for Disease Control website, cdc.gov/COVID-19. There's no dash in COVID-19, just COVID-19. There is a wealth of information there about how to prevent and protect yourself from COVID-19. The LA County Department of Public Health also has a very robust website with a lot of information about COVID-19. I appreciate you taking the time to listen to this. I urge everyone to take this seriously. And I think that all of us, if we do our part, we can help curb this illness. And hopefully with the vaccine coming on board, that will accelerate our ability as a country and as a people to conquer this infection that has become rampant in our communities. Thank you very much for listening. Assalamu alaikum wa rahmatullahi wa barakatuh.